Our greatest challenge with blood transfusion practices nowadays is that we're really not sure of where the risks are and exactly what the benefits are.
There is an increasing amount of scientific evidence that really has shown very conclusively that for many patients, perhaps up to 40% of patients that receive transfusions, the transfusion of that blood may be unnecessary or perhaps even inappropriate.
It's never really been a well thought out portion of medicine, if you will. It became available. It's always associated with a beneficial impact for patients, and it's never really had the rigorous test that we do for every other therapeutic intervention.
The general public perceives that giving blood or blood transfusions have a tie to love of country, love of family, doing good for others, being unselfish, and most people give blood with those good intentions, but the real challenge is to make people understand that there are much larger implications to blood transfusion than just these positive, good, feel-good messages.
In 2010, in the United States, there were approximately 30 million units of blood transfused at a total cost to the hospital systems, to society, to insurance companies, to patients themselves of close to $30 billion.
Blood is a biological product that has to be tested for pathogens, the ones that we know about, and there's always one that could be emerging on the forefront. So that testing process is very expensive. Transporting blood, transfusing blood, these are very, very costly things. So transfusion of blood is a very, very costly endeavor.
Over the last 10 years, there has been a plethora of studies and information that's come about that brings to light what some of the greater risks of blood transfusions are that we never really recognized beforehand. Blood transfusions have been associated with increased kidney failure, with increased lung failure, with increased length of stays and increased mortality.
If a patient has a problem or an illness or a death as a direct result of a transfusion of blood from the blood bank, you can imagine the liability is extensive.
And as we learn more about the risks with transfusions, then obviously hospitals need to start implementing programs to prevent those patients from getting to the point of actually needing a transfusion.
Anything that you're putting into the body like that, carries a certain risk. And whenever we can avoid transfusions, that's really important for the safety and the care of all our patients.
The Society for the Advancement of Blood Management is a professional organization made of multi-professionals, and it's multidisciplinary, with a charter to educate all in healthcare on issues related to patient blood management.
SABM promotes patient blood management, which is making best use of a patient's own blood so that it can avoid the risks associated with donor blood.
SABM's mission is to be able to help physicians realize what is being captured in research and in turn pharmaceutical aspects, devices that are coming out to be able to help surgeons reduce the need for allogeneic transfusion.
SABM works collaboratively with many kinds of organizations such as governmental organizations, regulatory agencies, corporate partners, in the efforts to bring together resources, education, knowledge, and funding to promote this concept of patient blood management for the benefit of patients worldwide.
SABM's membership is multidisciplinary, multi-professionals from all over the planet. We've got members not only from here in the United States, but from Mexico, Central America, South America, China, Malaysia, to Europe and Africa, who all see the need for a change in thinking in the way we traditionally approach blood management.
Well, I would strongly encourage my colleagues to sign up to be a member of the Society for the Advancement of Blood Management, because I think it's an extremely important part of where medicine is going today. The more we know about blood management, the better that we can treat our patients.
Our hospital has a big initiative towards hospital safety, and whenever you can avoid a transfusion, you are promoting safety within your institution.
Well, certainly myself and some of my colleagues have attended some of the SABM meetings in the past, and we found the programs to be very helpful.
Hospitals can benefit tremendously by having a collaboration with SABM. The research projects, the educational initiatives, these all benefit hospitals and the physicians and the nurses that work at them to learn the best techniques in patient blood management for the safety and benefit of their patients.
I'd say over the last 10 years, I've significantly limited the amount of blood transfusions that I've given and thereby significantly decreased the amount of adverse reactions that I've seen.
Not getting transfused is a good idea for everybody. Minimizing transfusion is a good idea for everybody.
What the patient's getting out of it is hopefully better health care.
If you want to be a local hero in your hospital, blood management's the place to be. It's one of those few places where you can really impact care and impact the bottom line at the same time.
SABM's ultimate goal is to improve the lives of patients worldwide by means of patient blood management. To achieve that goal, SABM needs the support and commitment of individuals, entities, corporations, partners that will further support this important mission.
There is so much more to do with educating clinicians. There is so much more to do with educating the public. We've only touched the tip of the iceberg in terms of the opportunities that patient blood management presents. With more funding, SABM could grow in its ability as well as the speed in which this education is conveyed. We need your help.